a quote in your book from Hippocrates.
Mm-hmm.
It's about knowing the person that has the disease rather than knowing what the disease is, right?
Yes, yes.
That's pretty powerful. He said that a long time ago.
Yes, so that question is hardly ever asked. When a patient goes to to visit a doctor, he doesn't ask what do you eat, how is your home, and how do you feel at home? Do you feel stressed at work? We now know that stress is still the most leading cause of illness. So we all say that, but we don't ask, what are you stressed about in your life? We just ask, we just say, oh, we need to do some tests. So we run some tests on you. That's the first thing they say. And so take the blood test, take this test, and have a CAT scan and whatever. And then we'll find out what's bothering you.
But that's the scientific medical model.
The first question would be if a person came to me with a problem and said, what's bothering you?
You would say, what's bothering you?
Yeah, and you usually get an answer. And you say, and then you probe a little bit, and they start coming out and say, well, I have this, I'm going through this divorce, and it's so painful. Well, that is a big stress. Ask anyone who's going through a divorce how painful that be. That's almost like a battle they're fighting. That means you are in the fight or flight response. What is your adrenaline doing? Where is it? That means you're constantly producing stress hormones that the body is not designed to do. If you are producing so much cortisol, your immune system is suppressed.
All right.
Cortisol being a stress hormone that deals with stressful situations. So once you make so much cortisol, it is such a powerful acid, it can destroy so many functions in the body, suppress them, that there is no chance for your body to heal under stress. It's impossible. So the patient should be should be considered first. Who is the person?
Then you will
rather
know.
than what you have.
Okay.
And what you have is irrelevant compared to who you are and what you are not able to deal with in your life.
Well, the stress is unrelenting in Western life,
It is true and not true. You can see it both ways. If I travel to an airport and I'm about to miss my plane, say, oh my God, I'm not going to make it, and I have a deadline to meet, and if I'm weak-hearted, then I may feel that this is the worst thing that could happen to me. I might have a heart attack. If another person, catching the same plane, going to the same place, the same conference or whatever, and is not making it, said, oh, I prefer to stay home anyway. I'd like to be with my family, my kids, and whatnot.
Taking it in stride.
So the first person has severe stress. The second person doesn't have any stress at all. He said, well, that's how life is. It's like a river. It sometimes turns left, sometimes right, and you just have to be with the flow. And there must be a good reason why this happens. So it has a completely different interpretation of a given situation. One becomes stressful over it, the other person doesn't. And so stress is not delivered to us like mail from the outside.
For some people it is.
It is our response to that situation, and not understanding why the situation happens in the first place, that we start rejecting it or trying to protect ourselves against it. When we try to protect ourselves against it, we have a fight or flight response situation. And that lowers your immunity, your digestion is impaired, you cannot digest food when you're stressed, you have a lot of undigested food, it clogs up your lymphatic system, and then you have issues like cancer, heart disease, diabetes.
And so it is, in a sense, psychosomatic, according to that quote from Hippocrates.
There is no illness that is not including the mind, because the two are not really separate. We have made them separate. Psychoanalysis, psychiatry deals with just the mind, and a typical health practitioner deals with the body. They should never have been separated. Mind and body are one. You can never say that I have a thought only. You have a thought and neuropeptides, powerful hormones in the body for every thought, a feeling, emotion you have. So you can never separate the two. Any kind of thought, feeling, fear, anxiety expectation, defensiveness, jealousy. It all translates into biochemistry in the body. Therefore, there is no separation between the two.
Is there a risk, though, of blaming the victim for their disease if you take that approach?
Not really.
Like, why have you given yourself cancer? You know.
Yes, so if you see cancer as a punishment,
All right, there
then
we go.
it becomes a blame. But if you see cancer as a survival mechanism and say, well, my body is doing the very best it can to help relieve itself of the burden, now I can unburden my body. So that puts the power back into yourself. So there's no reason to blame yourself and say, well, okay, you allowed this to happen, and maybe there's a good reason. If any person, any cancer survivor I speak to, and say, how do you see your cancer? And say, well, it's the best thing that ever happened to me. Everything changed in my life for the better. And now, if you are going for harsh treatments and you suffer terribly, you would say, this was the worst period in my life.
Okay.
So again, how you respond to the cancer, that is up to you. And that it's not about blaming anyone or anything.
All right.
It is about seeing it as a blessing and then turning it around to your advantage, so that you can grow from it, you can get stronger than ever, you can deal with some things that you have never been dealing with, like feeling not good enough, feeling sorry for oneself, feeling like always I have to be careful, low self-confidence. So cancer can turn these things around. I've seen it many times. People start standing up for themselves again. They are no longer taking what people say, the crap, what other people give them, and they say, well, no more. I love myself more, I honor myself more, I respect myself more, I accept myself the way I am. Doesn't matter what anyone thinks of me. So instead of giving the attention to what other people might think, you say, I'm important here. I'm just as important as I see other people as being important. And so not putting ourselves last, but putting ourselves first. And that is sometimes what cancer patients need to do, put themselves right first.
Become their own advocate.
Yes, and loving themselves, because there are certain things they didn't like about themselves, that they hated, that they were sorry for, that they felt guilty about. A lot of guilt drives cancer patients into trying to please everyone so that they love them back, because they don't think they are deserving to be loved.
But they are.
And they are.